Okay, so now we're going to do a bowel powder, which is a combination of herbs designed to help the bowel to eliminate old waste. And everybody needs those. Even if you're not technically constipated, you probably need some kind of gentle bowel cleanser. And the main thing to know about bowel herbs is that they're not laxatives. Some of the ingredients might be, but then the overall effect is tonic, so it heals the bowel. So what you're looking at is kind of a combination of bowel building herbs. So it works on the bowel wall to make it move a little bit in order to cause bowel movements. But then there are other herbs in there that actually build the bowel wall. So we'll go through all of those now. So first of all, we have cascara, sagrada, meaning sacred bark. That's an American herb, but we use this one because it's traditional and very mild. So 1.5 parts. Then we have yellow dock here again in powder form, and that's 1. Yellow dock root, that is really. Wormwood. Why might wormwood be in there, do you think, in a bowel formula? Cholagogue, stimulate the bile, maybe. But it could also be that the herbalist suspects maybe some parasites, yeah. Plantain, which is a wonderful herb that really draws waste out. It's nature's fantastic blood cleanser. And what would marshmallow be doing in there? Marshmallow root is a demulcent, so it softens tissue and heals any kind of inflammation in the tissue or any kind of irritation of tissue. It's what's called a vulnerary, which means a tissue healer. And that is 1 part. And then we have turkey rhubarb. Does anybody know what that's for? That's a cathartic again, a mild laxative actually. Turkey rhubarb root. And then ginger, 1/4 part, stimulant, and licorice, 1/4 part. And the purpose of that remedy is to get the bowel cleaned out. But these herbs are also tonifying and helping the colon. Marshmallow is really healing the tissue. So it's not just a laxative, it's very different. And we have our patients take those all the time. There are very few patients who come that we don't give a bowel powder to. And you take a little bit of the powder before your largest meal once a day. And then you basically have to explain to your patient to monitor the dose based on the results they get. So you don't want them having too many bowel movements that it's uncomfortable, but they should feel a good evacuation, so they can increase the dose if they need to. It's important you tell people that because sometimes they just stick to the dosage and they don't realize that actually, herbs are quite safe. You could increase it slightly. Okay?